Hi, my name is Sarah Mortimer, and this presentation discusses the widening scope of nursing practice. These are the SMART objectives for the presentation. I'm not going to read them all out word for word, but basically, by the end of this presentation, I want the viewer to be able to identify the effects of expanding nursing scope in nursing practice, in healthcare and its outcomes, and within society. Here we're going to talk about the influence that an expanded nursing scope has in nursing practice. Because of the large amount of people within the aging population, the distribution, type of nurses, and specialties in nursing have become even more important to analyze. Demand for the skills of nurses are at an all-time high, especially following the pandemic. Strengthening the education of nursing is essential in being able to adequately address health equity and social determinants of health. Stevenson, 2021. In a report written in 2021, it was stated during the pandemic that the scope of practice for nurse practitioners was changed to allow full practice authority in order to adequately treat the population during the time of the pandemic. There currently are petitions and reports urging the government to allow full practice authority beyond the 23 states and the District of Columbia that already allow it, to allow for the nursing practice to be able to meet the demands of healthcare today. Stevenson, 2021. In another article written by Kimberly Taylor, due to the shortage of providers within this country, allowing full practice authority within nursing practice for nurse practitioners and other advanced practice registered nurses will allow for more primary care to be delivered and result in less of a gap in access to healthcare. This will be especially true in underserved communities. Taylor, 2023. It has also been suggested that along with expanding nursing scope for advanced practice registered nurses, performance-based nursing becomes introduced as a way to put more value on the care nurses give, as well as offer more price transparency when it comes to the care that was given. This would replace the traditional and current system that just puts everything in a lump sum to pay for nursing care. It is suggested that a specific purchasing program be implemented that allows for the national database of nursing quality indicators, medical records, and information about the time that a nurse spends in a patient's room to be included. This kind of program would allow for more alignment with patient quality of care and performance-based values, which would subsequently improve patient outcomes. Cleveland et al., 2019. Here we are going to talk about the influence of the expansion of the nursing scope in healthcare itself. Nurse practitioners or other advanced practice registered nurses that have full practice authority, also known as FPA, have been shown to increase routine checkups, decrease emergency room visits, and improve the quality of care for patients. It has also been shown that nurse practitioners with no restrictions also result in lower drug costs within the healthcare system. Bennett, 2023. Studies have shown that including interdisciplinary teams that include advanced practice registered nurses improve patient outcomes, as nurses are historically known to lead team-based care. Allowing advanced practice registered nurses, such as nurse practitioners, to have FPA will again improve patient outcomes as a result. Cleveland et al., 2019. Allowing full practice authority for nurse practitioners will also help close the gap in primary care access, especially in underserved or rural communities. Because nurses make up a large amount of the healthcare profession that exists within underserved communities, allowing for them to operate as providers to the full extent of their education will hold the potential to close the gap in primary care access. Taylor, 2023. On this slide, we're going to discuss the expansion of the nursing scope of practice and its effect on society. Much like we talked about in the previous slide, having more fully functional nurse practitioners will affect society by not only closing the gap in primary care, but improving healthcare outcomes because of the ability to reach underserved communities. The pandemic highlighted how the health system was not prepared for a disaster, which is all the more reason that the focus on provider shortages is higher than ever. As well as serving less reached communities, nurse practitioners functioning as providers will also ease the burden on the health system, which will improve access to quality care, as well as allow for more people in society to receive care more efficiently. Taylor 2023. Like we have highlighted a few times, full practice authority for nurse practitioners has been associated with improved patient outcomes, as well as improved access to health care in society. Bennett 2023. The expansion of the nursing scope in all three of these areas is very important to consider and look at, as nurses are the largest group of healthcare professionals within the system, reaching at almost 4 million nurses worldwide. Stephenson 2021. In conclusion, we've talked about the expansion of nursing education to equip nurses to better care for patient populations. We've discussed the nursing role in healthcare equity as well as improving access. We've discussed the effect of what would happen if advanced practice registered nurses, such as nurse practitioners, were able to practice to the full authority of their education. And we've also discussed the expansion of the nursing scope and how it affects healthcare and society. These are the references that I used for my presentation, and thank you for listening. I hope you enjoyed it.